Good evening, Professor.
Hi.
As we are doing 30 days liver health challenge,
Yes.
so some of our viewers have asked some questions related to liver.
Okay.
So I thought this is the best time to talk to you.
Sure.
Our first question comes: what are the early signs of liver problem that I should be aware of?
So the first thing to tell your audience is that early liver disease has got no symptoms, and therefore, by the time symptoms start, it is actually delayed or late stage liver disease. So nearly 50 to 60% of the liver needs to be destroyed before people start getting symptoms. But just to answer the question, the commonest signs of liver disease is jaundice, what they call pilia, water in the abdomen because of ascites, hepatic coma or liver coma, and blood vomiting. So these are the things that I would think are the commonest signs of advanced liver disease.
Thanks for the signs that you have given us. And here comes the second question. How often should I get for liver checkups and what does it typically involve?
So it depends on your age. If you're 18 and you don't have any risky behavior, I think you really don't need liver checkups. But once you cross 40 or 45, I would recommend a liver screen at least once in 2 years. And if you have risk factors like diabetes or you know you're obese, then or you've had exposure to hepatitis B or C, then I would have more frequent annual checkups of the liver.
Now we move on to the third question. What are the specific foods that are particularly good or bad for liver health?
I get asked this question quite often. The simple answer is low calorie, high fiber, high protein, moderate use of salt is probably as good a diet for the heart, liver and brain. And most of our organs survive well with this sort of diet.
Thanks for giving us the good information about food. The next question. What should I do if I have a family history of liver issue?
So that's a very good question because some liver diseases do run in the family, including whether somebody has got fatty liver disease that progresses fast or fatty liver disease that doesn't progress. So some people with the same weight, two people both 90 kilos, one with a bad family history can have cirrhosis, the other one doesn't progress beyond grade 1 fatty liver disease. So if you know you have liver disease, then what I would do, or if the family has got liver disease, then I would get checked up more frequently in a liver center so that you know that you don't have to worry if all the tests are normal. The beauty of the liver is if you are able to address the liver's concerns at an early stage, most liver diseases are reversible.
Thanks for that, Professor. And is it possible to reverse damage caused to liver through the lifestyle changes?
Of course. So that is the key point of this Liver Awareness Month. The whole point is that if you are able to find these diseases at a pre-terminal stage, which is pre-cirrhosis, then the liver regeneration can happen, and that is the whole point of what we do at South Asian Liver Institute with our LICAP program, which is Liver Care Program, that aims to bring back the liver to a state of health from a state of injury.
Oh, that's great. Thanks for the good information. And how to cure fatty liver?
I think if you don't have diabetes and you're not obese and you have a healthy lifestyle, that means plenty of exercise and moderate diet, that means not overdoing the sweets, not overdoing the rice and carbohydrate, I think you'll avoid fatty liver disease.
Thanks, Professor, for all the information that you have given.
My pleasure.